Hello everyone, and I hope you all are doing great. Thank you for the live session. Today's topic is sleeping positions. What are some of the ideal sleeping positions, and what is good? Whether sleeping on your back is good, whether sleeping on your side is good, or whether sleeping on your tummy is good. Well, I'm going to discuss all of this, but we'll wait for a while and let people join in. And meanwhile, I would like to discuss about our upcoming camp dates. Well, we are coming to Bangalore for the second time, and this is from 20th to 23rd of June. 20th to 23rd of June will be in Bangalore. So if you guys are looking to see me in Bangalore, I will be there for the camp. We are at two places actually, Jayanagar as well as Marathali. So if you're looking to see me in Bangalore, please do visit and make sure you're taking your appointments for the same. The number for appointment is 800-6738-000. I'll pin this comment so that you can easily check the appointment number for convenience. Right, thank you so much. A lot of people are joining in. Thank you all for joining in. And today we are discussing about what exactly is an ideal sleeping position. We need to understand that sleeping is one of the activities which actually helps you to repair, helps you to recover. And it's very, very important that you have the right sleeping environment as well as understand what exactly are the best of the sleeping positions. So that holds a very important, place when it comes to, you spend about 1/3 of your life simply sleeping. So it's important that you exactly know what are the positions and what exactly needs to be done for a comfortable and a restful sleep, so that when you get up in the morning you feel fresh, you feel energetic, and you don't feel lethargic. You don't feel that probably you have not been able to complete your sleep at all. So that should not be the case. So talking about, firstly, there are three sleeping positions that we normally talk about. So first is lying down on your back. Well, lying down on your back is a good position for people who have some back issues. Definitely it rests your back, so it makes a lot of difference. But for people who have issues like sleep apnea or have issues with snoring, certainly not suggested for them to directly lie down on their back. Especially also people who have a huge belly, it is not really recommended that they should lie down flat on their back. Also people who have neck pain, now most of the time they're not able to adjust their positions when it comes to the neck. The neck goes either in too much of extension, or if the pillow is not supported well, so then there can be issues because of that. So lying down on your back is definitely suitable for people who have back issues or who have back pain, but not very suggested for people who actually have neck issues, or probably even have issues with snoring or apnea. Next, what I'm going to talk about is side lying position. Well, side lying position is definitely one of the best positions for a lot of people. About 60% of the people actually prefer lying down sleeping on their sides, because it's a very comfortable position. It is absolutely healthy and supports the spine and most of the organs in the right way. Of course, there are left and right side lying positions, and it is important that you support your knees and the other areas of the body through pillows and other things, so that your side lying position can have much better results. Well, talking about the left side or the right side, if you have issues with heartburn or gastric issues, then it is not suggested that you lie down on your right side. Then it is always suggested that you lie down on your left side, because that can probably increase your gastroesophageal reflux, or probably even if you have your heartburn, that can again increase, because it basically causes a little compression on the organs, on the internal organs as well as the digestive organs, and because of which there are chances that your symptoms may increase. In that case, lying down on your left side is always a better option. Your circulation goes better, and definitely it helps when you lie down on your left side. So ideally, if I have to tell you, lying down on your left side is the most favorite position. Next could be the right side lying, if you do not have GERD issues, or if you do not have heartburn, or if you do not have digestive issues. in that case right side lying is also a good option for you. In pregnant ladies, right or left side is always a suitable position. I have some questions also. I can see a few questions coming up and I will answer all your questions. So all you're supposed to do is stick to the live session, and yes, I will take up your questions at the end of the session. Talking about the last position, which is basically lying down on your tummy. Well, this is the least favorite position which I have seen, but oddly, I have seen most of my patients complaining of back pain or neck pain are actually in that position. Most of the time, they tend to, or they prefer sleeping in that position. So, whenever you are sleeping this kind of position, your breathing capacity is really controlled to a great extent. Your ribs and your overall lungs have to take up more load in order to breathe well throughout the night. If you do not have the right position of the pillows, maybe snoring can help in case of lying down on your tummy, but other things may not be so easy. So your breathing itself is very less, because of which you feel tired, you feel fatigued, you don't feel that you're working out with the best of your sleep, and because of which you have not recovered well. So that ideally I don't recommend lying down on your tummy. However, if you have that habit of lying down on your tummy, it is important that you support yourself with the right kind of pillows, because let's say using pillows which could support your head, or probably if you have a belly, it can also support your pelvic area, because of which the spine can be in a flat position while you lie down on your tummy, is a good idea. Same thing goes with any of the positions, if you ask me. Let's say even if you talk about lying down on the back, if you have a huge belly and if you still lie down on your back most often, then it's important that you also use a pillow under your knees. So when you use a pillow under your knees, the pelvic actually gets stabilized. It gets supported in the right way, because of which you can actually sleep with a flat back and be comfortable. Talking about lying down on the sides, whenever you lie down on your sideways, it's important that you support your knees, because if your knees are not supported, as you lie down and you bend the upper side of the knee and keep it supported with the pillow, so that actually helps you to kind of support your spine throughout that sleeping position. So that again is very important. Thank you everyone for joining in. We have a lot of people joining in, and yes, Kritika Kapoor has a question. For upper and middle back, which is the best way to sleep? Well, if you have a middle back pain, then obviously lying down on your back is not a good idea. You should think about you should prefer sleeping on sideways, and upper and middle back covers both of them. So sideways sleeping is always a better option when it comes to upper and middle back pain. So friends, this is more to do with a lot of people also have questions about pillows. What sort of pillows should be used? So whenever you're sleeping, obviously we all have the different kind of pillows that we use, but most of the time we are confused, especially when it comes to side lying. That is, whenever you lie down to right side or left side. So it's important that whatever is the distance between your head and the shoulder, this particular distance, you should have that sort of thickness in your pillow which can cover it and support your head in the right way, and it is aligned with the spine. So that's something which is very important. Your pillow doesn't have to be too soft, or it doesn't have to be too hard. It has to be of a medium consistency. That's what I always tell my patients. And you don't need to get into some ortho pillow and all kind of fancy pillows that you have, because it is not practical, or it is not possible that your head will stay in the same position throughout the night. So it obviously has to change, and you have to have that sort of option wherein it more or less should be flat, so that whether your neck goes on left side or right side, most important thing is it is supported in the right way. So you don't need a too soft pillow, or you don't need a very hard pillow also, because none of them actually solves the purpose. It has to be something of a medium consistency where it takes up the whole measurement between it takes up the whole gap between the neck and the shoulder, as well as gives you the right kind of support. Okay, so if you have any questions, please put in your questions and I'll be more than happy to answer your questions. This Saturday we are available in Bandra as well as Lower Parel. One question I have here, what are your timings for Mumbai? So Mumbai, we are available on Saturdays, and this Saturday we are available in Bandra as well as Lower Parel. Lower Parel will be there in the morning time, and Bandra will be there in the evening time. So if you're looking for appointment, you can do that on the same number. I've already typed the number and I've put it on the pin comment, that is 8006738000. And yes, we are conducting our second camp in Bangalore, which is from 20th to 23rd of June. And if you're looking to see me there, yes, all the follow-up patients and of course new patients can always take up their appointments and see me between 20 to 23rd. We will be at Jayanagar as well as Marathali for our camp. Thank you so much for joining in. Hope this topic was relevant and it was informative for you. So to summarize about this particular topic, this was basically about what are the best sleeping positions, and we understand that side lying is the best position that we can have, whether it is a right side lying or a left side lying. Now the right side lying will also depend on whether you have gastric issues or GERD issues, or whether you have heartburn issues. In that case, obviously the right side lying is not suggested, and it is preferable to lie down on the left side. In case you have back pain, lying down on the sideways or even on your back is a good option. Whenever you have back pain or issues related to snoring, side lying is always better compared to lying down on your back, because the moment you lie down on your back, you'll be very uncomfortable for breathing because of gravity, and that itself puts you in a wrong position, and your snoring can only become worst. So sleep apnea basically becomes worst in that case. Lying down on your tummy is not one of the most favorable sleeping positions that I would recommend. And however, if you have a habit of lying down on your tummy, try alternate positions also. And end of the day, it is obviously very subjective to have these kind of positions, but then it's always important to try something different, because you never know, you may be sleeping in the wrong positions, because of which you don't get a restful sleep, and then you don't get a good recovery and relaxation, and you end up with a lot of fatigue and more stress in spite of having probably a good sleep. So to make your sleep more effective, it's important that the right position is taken up when you sleep. Thank you everyone for joining in. So I think there were a lot of people, Noshin, Selling, Saili, Ritesh, Amruta, Ajay, Days, Rahul, Parvez, Narendra, Nirmala, Sutwal, Ayuja, Ratyash, Mitu Bhatia, Joshua, Umang, Yoga, Akash, Rahul, Manpreet. Thank you everyone for joining in. Dr. Amit, Dr. Meet Shah, Nilesh, Himani, Suraj Pandey, Ritu, Naomi, Akshay, The Height Choose Me, Gaurav Khetle, Mr. Nayak. Thank you everyone for joining in. Sagar Solanki, Kritika Kapoor, hope you're doing great. I'm coming to Ahmedabad very soon. We didn't see you in Pune this time. Huol Mendes, Devendra Bhagwe, Venu Nani, Samar Singhai, Sumit Salwa, Life of. Thank you everyone for joining in. And if you have any questions, you can always put in your questions on the live below the comment section, and we can take up a topic related to that, or we can definitely answer your question in the next session. So thank you once again for joining in.